Hey everyone, welcome back. Today we're doing a deep dive that you all specifically requested.
Oh, yeah.
Yeah, a deep dive into the chronic disease crisis in America.
Okay.
And to do that, we're going to be looking at a conversation between Robert Kennedy Jr.,
Okay.
who, as you know, is currently running for president,
Mm.
and Dr. Mark Hyman,
Right.
who's a physician. And they had a really fascinating conversation about this, and I think it's really relevant.
Yeah. I mean, it's a hot topic right now.
Right.
Like everybody in the wellness world is talking about it.
Yeah, and what I thought was so interesting about this conversation is that they
Mhm.
really connected the dots between kind of like individual health choices,
Yeah.
but also these larger systemic issues.
Right. They don't shy away from like pointing fingers at
They don't.
the food and even government agencies and stuff.
Right, and I think it's pretty bold, especially coming from someone who's like actively running for office.
It is for sure.
So let's dive in. Right out of the gate, they hit us with some pretty alarming statistics about the state of American health.
Right.
Did you know that 75% of Americans are overweight?
Wow, that's a lot.
It is a lot, and then 93.2% are considered metabolically unhealthy.
So that means that like almost all Americans have some level of dysfunction in their metabolism.
Right, and that puts them at risk for chronic diseases.
Like diabetes, heart disease, even cancer.
Right.
Yeah.
And it gets even more concerning when they point out that 6 out of 10 Americans are already living with a chronic disease. And on top of all of that, life expectancy in the U.S. is actually declining.
Oh, wow.
Which puts us behind over 60 other nations in terms of life expectancy.
Yeah, it's interesting because you think of America as like this really advanced,
I know.
like wealthy nation, but we're not doing so well on that front.
Not on that front, and it really is kind of like we're swimming against this powerful current here.
It is. And think about the impact on healthcare costs, too.
Oh, totally.
And productivity. You know, a nation struggling with chronic illness, it's going to struggle to thrive.
Totally.
Yeah.
So what is the root cause of all of this?
Right.
According to Kennedy Jr. and Hyman, they make a case that ultra-processed food is the main culprit.
It's the usual suspects, right? Like the
Like
cereal, the chips, the sugary drinks.
yeah, and they're saying that these foods are essentially designed to be addictive.
Right.
Like they're triggering that dopamine surge in the brain.
Like you see with drugs.
Yeah. So it's like we're being hijacked by our own biology.
In a way, yes.
Wow.
But the problem goes beyond weight gain, though.
Okay.
They explain that like this constant influx of sugar and processed ingredients, it leads to chronic inflammation
Okay.
throughout the body.
Okay. So explain what chronic inflammation is.
So it's like a slow burn that damages your arteries and your organs and even your brain
Over time.
over time. Yeah.
Okay.
So it's not something that you necessarily feel right away. But it's like this cumulative damage that happens over years.
Wow. Okay.
Yeah.
So now this is where things get really interesting to me, at least.
Okay.
Kennedy Jr. doesn't mince words when he accuses big food of basically prioritizing profit over public health.
Right.
He even uses the term corporate capture
Yeah.
to describe how these companies exert influence over like regulatory agencies,
The FDA.
the FDA,
Yeah.
and, potentially compromising the safety of our food supply.
Mm-hmm.
So he paints this picture of this system where misleading food labels, aggressive marketing tactics,
Especially towards kids.
especially towards kids,
Yeah.
are allowed to run rampant.
Totally. And he calls out the infiltration of fast food into school lunch programs,
Right.
which is impacting the health of the next generation.
It's a pretty scathing critique of the food industry and its influence on government policy.
It is.
What do you think? Does he have a point?
Well, I mean, there's definitely evidence to support some of his claims.
Okay.
Numerous studies have shown the negative impacts of ultra-processed foods. And there have been documented cases of industry lobbying
Right.
to weaken regulations. So it raises questions about who's really protecting our health.
Totally. And it makes you wonder, like, how much control do we really have over our own food choices when we're constantly bombarded with all this marketing and misleading information?
Right. Like, are we really making informed choices, or are we just being manipulated by these, clever marketing tactics?
So it's not just about personal responsibility then.
That's what they're saying.
They're saying there's these larger forces at play that are shaping our food environment
Totally.
and ultimately impacting our health.
Exactly. And they advocate for a multi-pronged approach that addresses both the individual choices
Mm-hmm.
and the systemic change.
Right. So you can make good choices, but if the system is working against you, it's an
Exact.
uphill battle.
It is.
Okay.
Oh,
This brings us to the mental health connection.
yes.
They spend a good chunk of time talking about how the food we eat doesn't just impact our physical health, it affects our mental and emotional well-being.
Right.
So they go into the science behind it, and they explain how inflammation, which we were just talking about, caused by a poor diet, can disrupt the balance of neurotransmitters in the brain.
It's like throwing off the whole delicate ecosystem in there.
Right.
Yeah.
And that can lead to mood swings, anxiety, even more serious conditions.
Yeah.
It's a pretty powerful statement. Are they suggesting that just changing our diet could have a profound impact on our mental health?
They believe it's a crucial piece of the puzzle.
Okay.
Yeah. And they cite studies
Mm-hmm.
that link ultra-processed food to increased risk of depression and anxiety and cognitive decline.
It's pretty mind-blowing to think that what we eat
I know.
could be contributing to the mental health crisis that we're seeing.
And they highlight the economic burden of mental illness, too.
Oh.
Like the lost productivity due to depression.
Oh, wow.
It's trillions of dollars.
That really puts it into perspective.
It does.
It's not just about individual suffering, it's about the collective impact
Exactly.
on our nation's well-being and economy.
They believe that addressing this issue requires a fundamental shift in how we approach both food and mental health.
Mm-hmm.
So it's about seeing the connection between the two
Yeah.
and recognizing that what we put into our bodies has a huge impact on how we think, feel, and function.
So how do they propose that we tackle this chronic disease crisis? What solutions do they offer?
Well, they suggest a combination of personal action and systemic change,
Okay.
starting with like taking control of our own health.
Okay, let's break that down.
Okay.
What specific actions do they recommend for individuals?
They emphasize making conscious food choices,
Okay.
and they even suggest starting with a 10-day sugar detox.
10 days.
10 days.
That sounds intense.
Yeah, but it's amazing how quickly your body adapts.
Oh, really?
Yeah, and starts to crave healthier foods.
Okay.
And they also stress the importance of like finding enjoyable exercise
Mm-hmm.
and incorporating more whole foods into your diet.
Right. And Kennedy Jr. actually shares his own fitness routine.
Yeah, he does.
As an example, he talks about like daily hikes and strength training and staying active with his kids.
Yeah, he's walking the talk.
He's walking the talk.
Yeah, and he emphasizes that it's not about like punishing yourself for striving for perfection.
Right.
It's about finding what works for you and making gradual changes.
Sustainable changes.
Sustainable, yeah.
Okay, so it's not about like this crazy overhaul.
Wow.
It's about making small changes that add up over time.
Exactly.
Okay.
And they believe that even small changes can make a big difference for our own health, but also for the health of the nation.
Right.
Yeah.
But they also acknowledge that individual action alone is not enough.
Right.
We need that systemic change
Right.
to create a healthier food environment and support people in making those healthier choices.
Yeah.
Okay, this brings us to the policy changes and the larger scale solutions that they propose. So buckle up because we're about to get into some
big ideas.
Some pretty radical ideas.
Yeah.
So they're really advocating for like a complete overhaul
Yeah.
of how we approach health
Mm.
as a nation.
The big vision.
It is a big vision. Where do they even begin with something like that?
Well, one of the ideas they put forward is a really clear color-coded food labeling system,
Okay.
like some South American countries use.
Interesting.
Yeah. So you could walk down the grocery aisle and see like bright green labels on whole foods.
Oh, wow.
Yellow for like moderately processed things and red for those ultra-processed products.
That's actually
What we've been talking
a
about.
really cool idea.
Yeah.
Because then you don't have to read all the complicated ingredients.
Exactly.
You just look at the color.
It's a visual cue to
Yeah.
guide your decisions.
That's really cool.
And it makes healthy choices the easy choice.
Right. Especially for like busy families. Yeah.
Who don't have time to like analyze every single label.
Totally. And Kennedy Jr., he's known for his strong opinions.
Yeah.
So I imagine he has some equally bold ideas about tackling this influence of big food.
He does.
So what kind of policy changes does he propose?
Well, he talks about using what he calls the bully pulpit
Okay.
to promote healthy eating habits
Oh, okay.
and raise awareness about the dangers of processed food.
So basically using his platform
Yeah.
to advocate.
For public health.
Okay.
Yeah. And he believes that's the president's responsibility to lead by example.
Yeah, he even hints at like the possibility of regulating or eliminating pharmaceutical and junk food ads
Oh, wow.
on TV.
That's a big one.
Which would be huge,
Yeah.
considering how much money they spend on that.
Yeah, targeting consumers, especially children.
Yeah.
Yeah, but I mean, some people might see that as like government overreach.
Right. Some people might applaud it. Other people might be like,
Right.
this is not okay.
Yeah.
It's complicated, for sure.
It is a complex issue.
And what about the school lunches that he was so critical of?
Yeah, so he wants to see a complete overhaul of those,
Okay.
moving away from the processed, prepackaged meals
Okay.
to fresh, whole food options.
Okay, so cooked on site.
Yeah, prepared on-site whenever possible.
So basically giving kids nutritious food
Exactly.
instead of just like filling them up with empty calories.
And they argue that it's an investment in the future.
Oh, interesting.
Yeah, like healthier kids mean a healthier workforce.
Down the road.
Yeah, exactly.
So they're really thinking long term here.
They are. It's a long-term strategy for a healthier nation.
But wouldn't those changes face a lot of resistance?
Oh, absolutely.
Especially from those companies?
Yeah, the industries that profit from the status quo.
Right.
But they acknowledge that, but they say the urgency of the crisis demands bold action.
Right.
Yeah.
Yeah.
Kennedy Jr. argues that we're at a tipping point.
Okay.
And we need to act now to prevent further decline.
Okay.
Yeah.
He seems ready to shake things up.
He does.
But beyond these like big policy changes,
Yeah.
what about smaller scale solutions?
Well, they believe that empowering communities is crucial.
Okay.
Yeah. So Hyman especially is a big advocate for like grassroots movements and community initiatives.
Can you give me an example?
Yeah, like establishing wellness centers,
Okay.
especially in underserved areas.
Okay.
That could offer things like cooking classes, nutrition counseling,
That's a great idea.
community gardens.
So creating a space where people can come together
Yeah, and support each other.
to learn.
Yeah, and connect.
Yeah, that's really cool.
Yeah. And they also talk about the success of programs like San Patrignano in Italy,
Okay.
which is a community where people struggling with addiction,
Okay.
they can find healing through meaningful work and connection to nature.
So it's like a holistic approach.
Exactly,
Here in this-
addressing all those different dimensions.
That's awesome.
Yeah.
And they envision a future where health isn't just the absence of disease.
But it's like a fundamental part of our culture.
Part of who we are.
Yeah, and identity.
That's powerful.
It is.
But wouldn't that require a massive shift in mindset?
It would for sure.
Like not just for individuals, but
Yeah.
for like our institutions and everything.
Yeah, they believe it's necessary but achievable.
Oh, okay.
And they point to other countries that have done it successfully.
Oh, interesting.
Yeah, showing that it is possible.
That's to create a healthier society.
Yeah.
It's inspiring to hear them talk about it with such passion.
It is.
But what about the mental health connection?
Yeah.
Do they propose anything specific for that?
They see it as like an integral part of the overall solution.
Okay.
By addressing those root causes of chronic disease, primarily through diet and lifestyle, we can reduce mental illness.
Oh, so it's like
A 2-for-1.
a 2-for-1.
Yeah, you improve your physical health.
And your mental health.
Exactly. They emphasize that inflammation.
Mm.
I remember that we talked about that.
Yeah.
Plays a huge role in mental health disorders too.
Wow.
So by reducing inflammation, through diet and lifestyle,
Mm-hmm.
you can create a more resilient brain.
Oh, that makes sense. Okay.
Yeah.
But what about those who are already struggling?
Yeah.
What solutions do they offer for them?
They advocate for a more holistic approach
Okay.
that goes beyond just medication.
Okay.
So they believe in things like mindfulness yoga,
Right.
nature immersion to manage stress.
So a more integrated approach to health
Exactly.
that recognizes the mind-body connection.
Exactly. They believe true health encompasses all of it.
Yeah.
Mind, body, spirit,
Wow.
all of it.
It's refreshing to hear that, especially in a culture where we want the quick fix.
A quick fix, yeah. We like to put
Right.
things in separate boxes.
Right. This has been a real eye-opener.
It has.
We've covered so much.
We
The
have.
statistics,
Yeah.
the solutions.
Yeah, the individual responsibility,
Mhm.
the corporate influence,
You're right.
the government policy.
The food and mental health connection.
It's complex.
It is complex, but it leaves me feeling hopeful.
Me too.
It's inspiring to see people like Kennedy Jr. and Hyman raising awareness
It is.
and advocating for change. But
yeah.
before we wrap up,
Yeah.
they leave us with one final
Thought-provoking. Question. Yeah. Okay, I'm all ears. What is it? Okay, so what is it? What's the question?
Well, they ask, is addressing this chronic disease crisis crucial for America's future success.
Ooh, that's a big one.
It is. They believe it is, of course, but they want us to consider why.
Yeah, they're really asking us to think about how individual health is tied to, like, the fate of the nation.
Right. They're saying a healthy population is the backbone of a thriving society. Like it impacts everything. Economic productivity, innovation, even national security.
Right, because if people are always sick,
Yeah,
then it's going to drain resources.
totally.
Lower productivity, it's going to hurt the economy. Exactly.
Yeah.
And it goes beyond just money, too. They argue that a healthier population is going to be more engaged in their communities,
Okay. Yeah, that makes sense.
more resilient when things get tough,
Yeah.
you know?
Right. And probably more likely to make good decisions for the future.
Exactly. It's like individual health is the foundation for a strong and vibrant society.
That's a good way to put it. So they're basically saying that investing in health isn't just about treating illnesses. It's about investing in the future of the country.
100%.
So what would a healthier America look like to them?
Well, they talk about a society where healthy choices are just the norm, where fresh food is easy to get and it's affordable
For everyone.
for everyone, where communities are designed to make it easier to be active,
Okay.
and to connect with people, and where mental health is just as important as physical health.
That sounds pretty ideal.
Right.
Do they really think we can get there?
They do. They point to other countries that have done it. They say it takes political will, social change, and people taking action in their own lives.
So it's not just about waiting for someone else to fix it. It's about all of us doing our part.
Exactly. They believe change starts from the bottom up.
From the ground up.
Yeah, with each person making good choices and demanding better from our leaders.
Wow, this deep dive has given me so much to think about. It's easy to forget about the big picture sometimes, just get caught up in everyday life.
It's a good reminder that our health isn't just about us. It affects everyone,
Yeah, we all have a role to play in making things better.
for ourselves and for the future.
Well, thanks for taking us through this deep dive. It's been fascinating.
My pleasure.
So to our listeners out there, we'll leave you with that final question. Is addressing this chronic disease crisis crucial for America's future success?
What do you think?
That's all for this deep dive. Until next time, keep exploring.